and lower in many of our rural areas. So we hope our outreach efforts will reach those lesser vaccinated areas to help move us towards that goal. But reaching it by July 4th, we need to step up the efforts, not just DHEC, but the rest of South Carolina community stepping up the efforts to be vaccinated.
And that last note about outreach efforts and messengers is a good lead into this question. So have any new community outreach initiatives been launched to help reach the goal? And if so, when would they be launched?
Sure. Well, I have good news on that front. For the first time, we are sending direct mail postcards to every household in the state that provides simple and important information about COVID-19 vaccines. We had sent direct mail postcards to certain areas of the state before to promote testing, but this is the first time we're going to send a notice to every household. And for those people who receive them and you're already vaccinated, great. Thank you for doing your part. But second, share your postcard with a friend or family member who hasn't received their shot. Share your story. Talk to them about why you got vaccinated and what you experienced. We need vaccine stewards who are doing their part to stop the pandemic by spreading messaging. It's mouth to mouth, word to word communication that is really going to make a difference here. We're also working to have our call centers able to call people who are overdue for their second shots, to give them a gentle reminder that they're overdue, remind them of the importance of getting fully vaccinated, and to help them make their second dose appointment. We want that human connection of a person calling, not just a robocall or an email or a text message. Although those are effective ways to notify and reach people too, but we want to make sure people have that human touch that they can connect with and people that they can ask questions of and receive factual information that hopefully prompts them to get their second shot, which is so important for reaching full immunity.
The variant dashboard has been updated to include data on the parent of the Brazilian strain. Is that P.1 or P.2 specifically or something else? And when were those Brazilian strain cases first discovered here in South Carolina?
Sorry for confusion about P1 versus P2 strains, but here is the deal. Late last week, we confirmed that there were 10 cases of the Brazilian strain, specifically all the P1 strain. And our dashboard was updated late on Friday to reflect that information. Our variants webpage is updated weekly on Fridays.
Can you tell us how many people have used the federal vaccination site in Columbia versus its capacity?
Sure. The capacity at the Columbia site is 1,000 shots per day. And these doses are coming straight from the federal government. They're not part of the state's allocation, as this is a federally supported FEMA site. These community vaccination sites, such as the Columbia site, are occurring in states all across the nation. We've been averaging about 315 doses per day. As of this morning, more than 6,500 total doses have been administered today, and today is the first day for people to begin to return for their second shots. We've been in touch with our counterparts at neighboring states, and it sounds like who are also having these clinics, and it sounds like our daily administrations have been similar to theirs. The CVC site, the community vaccination site in Columbia, will be offering the one-shot Janssen vaccine from May 27th through June 9th. And so we hope that we see an increase then, because we know that there are many people who are still interested in receiving that single dose, one and done vaccine.
Is South Carolina planning to change its in-state vaccination allocation model in any ways as demand drops?
Our regional care panels continue to meet. We have 4 care panels, one for each region of the state. And you can find those meeting agenda and minutes on our website. And those care panels help advise us with regards to vaccine distribution within those individual regions. We also provide recordings of their meetings there, so if you want to hear the discussion for whatever region that you're interested in. Right now, we are continuing to base our statewide request for vaccine each week based on what vaccine providers order.
Sorry, Dr. Kelly, got to flip the page. Okay.
That's okay.
Do we know that vaccination rates are lower in rural areas? And what parts of the state are you particularly concerned about in terms of the vaccine uptake?
You know, I mentioned earlier that the coastal counties seem to have the highest vaccine uptake. And at the flip side, some counties do really stand out for lower vaccination rates. Cherokee and Marlborough County, for example, are the two lowest, but we do have a number of other more rural counties that have lower vaccine uptake. And we have concern about perhaps that's an access issue, perhaps that's an information issue. So we're trying to address both of those concerns. Saluda, Lawrence, Union, Lee, Chesterfield, and Jasper counties all have lower rates than we would like to see, and we're making that effort in outreach to boost those numbers.
I've got about a paragraph of questions here, Dr. Kelly.
All right.
So bear with me. So has there been any conversation between the Biden administration and DHEC about shifting toward a demand-based model for dose allocation for the states? And of course, as a follow-up, if so, what was the nature of the conversation? Given that supply is outpacing demand for doses, is DHEC talking with the governor about plans to decline doses for the sake of the federal pull?
So I can't speak specifically to all the conversations that were had, but we have had public health officials who are communicating with the governor's office and other state agencies on a daily basis. I'm not always part of those conversations. I do know, though, that at this time the decision has been made that we will continue to base our state's weekly vaccine orders of Moderna or Pfizer based on what providers are requesting that they need each week. Plus, we'll keep a reserve of at least 5,000 doses each, which includes first and second doses of the state's redistribution warehouse, just in case we need them for use in an emergency or an unforeseen circumstance, such as shipment delays because of weather, which is something that has happened before. We'll also continue to request the full amount of Janssen vaccine that's available to our state, which is currently about 8,000 to 11,000 doses per week. The nice thing about the Janssen vaccine is it's easy to store, it's safe and effective, it's a single shot, and it's a vaccine that can better support our community-based efforts, such as the vaccine clinics or mobile vaccine efforts, especially in our rural clinics. We'll continue to work with our federal partners as states work to address the decline in the COVID-19 vaccine administrations nationwide.
With COVID cases in younger populations and upcoming prom and graduation celebrations, what concerns does DHEC have? And secondly, can you talk about the infection and hospitalization rates among teens lately now that more of the older population has been vaccinated?
Sure. So let me start with prom and graduation ceremonies. You know, Pfizer vaccine right now is approved to 16 and up and may soon be approved for ages 12 years and up. So if you're old enough to go to the prom, you're old enough to get vaccinated and do it safely. You know, an increase in cases among teens is definitely a concern for us. We have concern that prom and graduation events are going to be super spreader events. You know, prom is definitely a concern. And, you know, I would just put to families and teens that many colleges are requiring COVID vaccine anyway. We might as well get it done now. And in terms of what are we seeing about infection and hospitalization rates, did you know that it is the age 15 to 34 group that is the highest increase, the biggest group for new cases in South Carolina right now? And we are starting to see some hospitalizations. Young, previously healthy people sometimes still get severe illness requiring hospitalization. So we are concerned that we are starting to see more young people with an increase in cases and more young people with severe disease.
And that is a perfect lead-in to this next question. So even though vaccinations have been available for people 16 and up for more than a month, younger age groups are still lagging. So the first question is why that might be. And then secondly, why is it important for young adults, those 16 to 34 specifically, to get vaccinated? And what is DHEC doing to increase vaccine uptake?
So national polls, Kaiser Family Foundation, NPR, and others, as well as polls that we have done here in South Carolina, indicate that the younger age groups, they just don't see a need to be vaccinated. They don't fear getting COVID-19. They don't see a reason for them to be vaccinated. So I just want to raise a couple of points, a couple of the advantages specific to them. I mean, why is it important for them to get vaccinated? Well, let me put it in some social terms that might appeal more to the age 16 to 34. Number one, if you get COVID, maybe you won't get severely ill, but you'll have to isolate for at least 10 days. Gone from fun summer activities, gone from summer job, gone from travel, sports practice, isolated from friends. And on the flip side, if you do get vaccinated and you are then exposed to COVID, you are close contact to someone who's sick, if you're fully vaccinated, you don't have to test. You don't have to quarantine as long as you don't have symptoms. No missed events. And you can get together with other people who are fully vaccinated. You can get together with your fully vaccinated friends and family, no masks, no distancing. I mentioned before the variants. Vaccine is our best bet for stopping these variants. So if you're not concerned about getting sick, be concerned about what might happen to folks who can't get vaccinated, like little kids. We don't have a vaccine for little kids at this point. And it's not worth taking a chance with COVID. Some young people, as I mentioned, they do get severely ill. And even those who just get mild symptoms, sometimes they have symptoms that just hang on for months. So, why is it important for young adults, age 16, 34, to get vaccinated? There are, real social reasons for them to want to get vaccinated. And I feel like they haven't really thought all those things through. And one of the things that DHEC has been trying to do to increase vaccine uptake is to get across those messages. For older adults, it was the message of protect yourself. You could become severely ill. This is a bad virus. And those messages are still important for younger people as well. But there are a lot of other messages about preventing the continued mutation of this virus and all the social benefits of getting vaccinated now.
Does DHEC have any comment on the FDA potentially endorsing use of the Pfizer vaccine in children 12 to 15? Many parents say that they are not sure if they want to get their children vaccinated. What kind of ways will DHEC address vaccine hesitancy for parents of those eligible children?
Pfizer tested this vaccine in over 2,000 young adolescents aged 12 through 15, and they had excellent results. They had 100% efficacy against 100% efficacy against symptomatic disease. It completely prevented kids that age from getting symptomatic disease. And there were no serious adverse outcomes. The symptoms after vaccination, like sore arm or feeling achy all over, was similar to the older teenage young adult group. And we've been preparing for this forthcoming announcement for a long time. We don't anticipate any barriers or delays in our state's providers being able to safely and quickly administer the Pfizer vaccine to young adolescents age 12 and older. And in addition to using some of the recommendations provided in the CDC's COVID vaccines toolkit for school settings and childcare settings, we are finalizing messages to our state's vaccine providers and to pediatricians who serve this older pediatric population, encouraging them to speak to all their young patients and their parents or guardians about COVID-19 vaccines. We're also working with the South Carolina Adolescent Immunization Task Force to share key messages. We're currently developing a toolkit and guidance to share with the South Carolina Department of Education, South Carolina Independent School Association to assist with community vaccine provider events and coordination for eligible students through the end of the school year. Now, we're also planning to work with the South Carolina Department of Education to host vaccine clinics in schools to make it easy and convenient for students to get their Pfizer shots. though the majority of these school-based vaccine clinics probably won't begin until summer vacation so that we don't interfere with school day activities. DHEC public health officials will work to be available as much as possible, take part in those meetings, other public speaking opportunities held by schools or school districts so that we can help inform, answer questions, educate parents, teachers, and students. At this time, DHEC is not recommending that the COVID-19 vaccine be required for school. However, we are strongly encouraging everyone who wishes to be vaccinated get their shots as soon as possible. Our message to the schools is that we encourage vaccination for students 12 and older to be family events, not just for the student. Bring in the unvaccinated parents and their children to get their vaccines together. While young people in general experience milder symptoms as when they're infected with COVID-19, as I mentioned, they can spread the virus to others. And having virus circulate widely as it is right now is of concern for developing new variant strains. And as the variants continue to rise across the state and nation, we are concerned. We can encourage children and parents and guardians to have fact-based conversations about COVID-19 vaccines with their pediatrician, with their healthcare provider, with their pharmacist, and make sure that what they are sharing is medically backed information, not pseudoscience, but medically backed information from sources like DHEC or the CDC. We'll continue to provide current and updated information and materials in the schools and child care centers section of our COVID-19 webpage as part of the ongoing effort to keep parents, teachers, educators informed of the latest COVID-19 and COVID-19 vaccine recommendations.
So how will vaccinating younger children help with reaching herd immunity, and I know you don't like that term, or we could say community immunity, in South Carolina?
Sure. Community immunity is a good term because we're all in this together. Vaccinating those age 12 and up will help to slow community transmission. And as we slow community transmission, which is at moderate levels in South Carolina as a whole right now, it will slow the virus from circulating. We'll have fewer people infected, fewer people in the hospital, fewer serious complications and deaths. So, will vaccinating younger children help, down to age 12 and above? Absolutely. This is an important group that congregates together, shares viruses together. It is important to get them vaccinated as well.
So I'm going to do something a little different today, and that is to let all of our media partners know that we've got 2 more submitted questions that Dr. Kelly is going to answer, and then I am going to turn it over for live Q&A. So I want you to be thinking now about what questions you have for our assistant state epidemiologist so we don't have a big lag there. Please don't unmute. Just raise your hand like Dana just did. So Dr. Kelly, what is the DHEC stance on masks in schools? And what is the agency's response or reaction to making masks optional for students at Lexington Richland School District 5?
As Dr. Simmer provided in a statement last Friday, DHEC's role is to focus on public health and to help save lives and protect from disease spread during this pandemic. From a public health point of view, DHEC continues to recommend that children should continue to wear masks in school at least through the end of this school year. When school starts in the fall, we can have a whole new conversation and review recommendations based on how many people are vaccinated, how much community spread we have out there, how close we are to that community immunity. And, I, for one, we all hope that masks will no longer be needed for students. And looking where we are right now in the COVID-19 response, we're hopeful, right? We've got cases are decreasing and number of people vaccinated increasing. We're making good progress. We're starting to see infection rates drop, but we're still seeing a percent positivity hovering around 4 to 5%. So that means there's still disease transmission in communities. We encourage everybody to continue to wear masks regardless of whether this is a mandate in your town, city, or county. We know that masks work. And we support current federal CDC guidelines. We believe that staying the course with regards to wearing masks and taking other precautions is really the best approach. With regards to the fact that the Lexington-Richland School District 5 made masks optional, I'll just have to say from a personal point of view that I'm disappointed. I had hoped that they would continue with the masking mandate for in school, but I understand that the district chose differently. I hope that they would still maintain some other important mitigation measures in place.
Okay, Dr. Kelly, the last submitted questions. If schools do drop those mask guidance, should other safety measures be beefed up or reinforced, which I think is the point you were just trying to make?
Yes, that's exactly the point I was trying to make. Masking is an important prevention measure, but it's not the only measure. So if a region has loosened up on their mask measurements, then making masks optional, well, that doesn't mean that we drop the other interventions, keeping distance, frequent hand washing, keeping students in cohorts, so that if one gets COVID, you don't have to quarantine the entire class. You just need to quarantine and do contact tracing within that cohort. And as much as possible, bringing activities and classes outside. Outside is so much safer than inside.
Thank you, Dr. Kelly, for that. And I appreciate the media partners raising their hands. I think this is going to go a little more smoothly today. I will ask that you only ask one question, and I usually lower your hand after you ask it. So if you have another question, just shoot your virtual hand back up. And once everyone has had an opportunity to ask their questions, I will circle back to you. Dana, I do think yours was the first hand raised. What question do you have for Dr. Kelly?
First, I want to share some information that I had asked about with the Dr. Trexler briefing. The national campaign, I swear I heard a website for. I found it, and I just dropped it in to the chat. It's like the one that you guys have on the DHEC page, how you can get your community involved. It's really kind of everything you have. All right, now my question. We know you don't like herd immunity. Everybody else, up to and including Dr. Fauci, they're all saying, can we get off the herd immunity thing? It's an elusive, mystical number. Do you think that's going to help to get people to stop thinking about there's a definite end game here, and once we get there, we're done, and to be more reasonable and get vaccinated?
That's a good point. That's exactly why I don't like the term herd immunity, because people view it as a magical number, that once we achieve this, we're done. Or if they hear, oh, we're at 65% and 70% is the goal, then I don't need to get vaccinated because we're almost there yet. It just doesn't work like that. It is not. It depends upon biology and behavior. So biology is, how contagious is this virus? Well, this is changing, right? How contagious was the, quote, wild type, the original Wuhan virus? That's one thing. The British variant, the South African variant, they are more contagious. So that's a moving target. If they're more contagious, they spread more easily. So that's biology. What about behavior? Well, virus is not going to spread as much, as quickly, if people are all spread out versus they're all gathered together, like in a school setting or in a social event. So that's the problem with hanging your hat on an exact number. So rather than just people feeling frustrated with, well, what do we do? I mean, how do we know if we're getting closer? What I would look at is the case counts and the hospitalization counts. And then I say that because the case counts, of course, they depend upon people getting tested, including people who are asymptomatic, might not be getting routine tested. But that's one metric we can follow. As those counts go down, we know we are getting closer to walling off, in a sense, this virus, walling off new infections. We're always going to have some breakthroughs. This is not, smallpox elimination. I don't think we're ever going to 100% get rid of this virus. I do think it's going to continue to pop up. But if we can get it down to low enough community transmission, then the whole game of severity will change. The other thing that we need to be looking at is hospitalizations, because if you're hospitalized with COVID, well, then you know that was serious disease. We are still continuing to see serious disease. So whether you call it herd immunity, community immunity, however you want to phrase it, we're not there yet. And the reason I don't like a number is because it's a moving target.
Chris, you've got a question?
Yeah, thanks, Dr. Kelly. I was the questions about the federal pool and the Biden administration. So with that in mind, it sounds like Moderna and Pfizer, the state is not ordering its full, more or less, availability. Do you have any expectation as to how many doses that would be made available to South Carolina will now instead end up in this federal pool that might go to other states in higher demand?
Right now, as a nation, we have more vaccine. That supply exceeds demand, and the manufacturers are continuing to make more and more vaccine. So I'm no longer worried that we are in a situation where we're afraid we need to hang on to every dose because, we're afraid we might be short, run short. We have more vaccine available to us than we have demand right now, and that's true for the nation as a whole. So if we're not getting, requesting all of the doses of Pfizer and Moderna that we could request, that's okay. And that's okay for a couple of reasons. Number one, we don't want them sitting in freezer situations where they might expire, because that would be unused vaccine, and that's no good. Better, it should go to places that can utilize them right away, because we're not worried that there's no more vaccine coming. There's plenty more vaccine coming. These manufacturers are making more. The reason we're taking all of our Janssen is because we've got different plans for the Janssen vaccine. For mobile clinics, it can sit for 6 months in the fridge, so it's easy to store it. Pfizer and Moderna, we're doing it more through other vaccine provider partners. So we want to pay attention to what they are ordering. If they're saying, stop, my freezer is full, I just want this amount and no more, I think we need to pay attention to that. So in terms of it kind of going back into some other Federal Reserve that it might go to another state, we're not worried about that. There's plenty of vaccine now. We are not where we were in January.
Michelle, you've got a question? Michelle, can you unmute, please?
Yes, sorry, couldn't find the button. Hi, Dr. Kelly. I apologize if I missed this earlier. I was just wondering if you have on hand the number of vaccine doses that are allocated to South Carolina for the upcoming week and the total number that DHEC will be ordering tomorrow.
I know for Janssen that we're receiving between 8,000 and 11,000 doses. I don't know off the top of my head about Pfizer and Moderna, but I know that information will be on our vaccine allocation page.
Judy, you've got a question?
Yes, thank you, Chrissy, and thank you. Oh gosh, I can't even, I'm so sorry, my brain cramp. Let me ask this question. It's going back to school masks. In the interest of addressing concerns with facts, what would your response be? What is your response to those who say they do not want their children wearing masks at school indoors because, number one, it is dangerous and obstructs their breathing, or number two, they consider it child abuse to wear it for that length of time?
So I really sympathize for all the worried and angry parents who are out there. They're scared for their children. Unfortunately, they're also victims of misinformation. And I don't remember if I had mentioned to this group before, I apologize if I did, but there was a publication in I hesitate to call it a journal. There was an article printed in a publication by the name of Medical Hypotheses. And they say right up front in this journal, their guide to authors are that they publish any theoretical, hypothetical, speculative, or even radical ideas that do not necessarily have to be based in any data or studies. It's like an editorial, but they are interested in receiving opinion pieces that may present very different points of view. Well, there was one recently published by an author who claimed he was from Stanford University. Stanford has come out with a statement that this individual is never employed by Stanford, and that in fact, the publisher of this article has since withdrawn the article. However, there are a lot of worried parents who got that article on social media and they have just been taken in. They have been manipulated to believe the misinformation that was presented in that article. And so the whole idea of hypoxia, low oxygen levels, or smothering in your own carbon dioxide, all of that is manipulated, non-factual information. So my first concern to parents is, my heart reaches out to them because they're worried about their kids and they're reading something that they think is legit. And so they're frightened by that. So I can certainly understand that. I wish we could find a way to communicate with them so that they understand what are the facts on this on this situation. And in terms of public health measures, we still stand behind the public health measure of masking. We still stand behind the fact that it's not been demonstrated to be detrimental physically to any group of individuals. I think about doctors, nurses in the operating room for 8-10 hours a day wearing masks, and they're not hypoxic. But I know that ultimately these decisions come down to the individual school district, school board, or in private schools, individual schools making those decisions. So number one, my heart goes out to them. Number two, I would encourage people, when you receive information, that you double check it, that you fact check things. And there are plenty of fact checker websites out there. Factcheck.org out of the Annenberg School of Communication, for example.
Mike, you've got a question?
Yeah, thank you. What's the mobile future for vaccination? My understanding is right now these are food truck style operations, expensive to set up and only a handful in the state. What would it take to get to a place where we just get a nurse and an Uber getting out to rural areas? What kind of hurdles would that take?
Well, and we're working with partners to do that. Prisma Health, for example, has mobile units of their own, and they have their own plan. They collaborate with us to coordinate so that we're not duplicating efforts, and they've been reaching rural areas. So does MUSC, so do some of our FQHCs. Some of our rural counties don't have hospitals. They've got a limited number of vaccine providers, but they all have federally qualified health centers who are doing those, community vaccination events. So I think in the beginning, we were doing this much more based at large facilities. Right now, we're doing mass vaccination events. Our next phase is moving into exactly that sort of scenario, bringing vaccine via mobile clinics or pop-up clinics out into the community.
Okay, so we've been through all of our media partners. We're going to go back through. We got about 4 minutes left. Chris, you've got another question? Can you ask your question, Chris? It looks like you're unmuted, but I just don't hear you.
There we go. On the vaccine allocation website, it looks like there are roughly 300,000 doses that are available but unordered. Is that the pot of doses that would, in theory, be making its way to that, federal pool, as it were?
300,000 that are, say that again?
So on the vaccine allocation dashboard, it said that there are roughly 81,000 doses that are available but have not been ordered. Is that the pot of doses that would, in theory, make its way, to the federal government if we determine that they're not needed here in South Carolina?
I believe that's correct. I might need to double check that to look at the site myself, but I believe that is true.
Yeah, and Chris, this is Christy. So I'll check with our immunization team because that's not Dr. Kelly's in and out the day and day. So we'll just double check on that, make sure that we get you the right information on that. Judy, you've got a question?
Yes, Dr. Kelly, I wanted to get any information you might have about the anticipated emergency use authorization for younger children, 12 years old and up. In terms of vaccine distribution, does DHEC have any different plans? Would we just incorporate them into existing clinics? Would there be more of an effort to do those vaccinations at pediatrician offices? What would that rollout for that age group look like?
Yeah, absolutely. And the answer is all of the above. So certainly they can go to all the sites that are right now offering Pfizer vaccine. It's the same vaccine. It's not a different formulation. So it's the same vaccine and the same, get first dose and second dose 3 weeks later. So they could get it at any of the facilities that are currently administering Pfizer vaccine. But yes, we definitely have plans working with the South Carolina Hospital Association, South Carolina chapter of the American Academy of Pediatrics to make sure that pediatricians are aware of the availability of this vaccine and of the EUA and of their ability to enroll as vaccine providers so they can just receive vaccine directly to their offices so they can order vaccine to provide to their patient panel, to the adolescents that they are serving. But we're also hoping to organize, as I've mentioned before, school-based clinics where we could vaccinate not just these teens, but hopefully the entire family, get those young adults who aren't vaccinated yet as well.
Judy, you have a follow-up?
Yeah, I just had a quick follow-up because I remembered there was a question earlier about the 16 years old and older and whether they needed parental permission. And if I remember correctly, they do not. Will that change with the younger group being brought in?
Great question. So the federal government has said that ages 12 through 15, the only stipulation that they require is that the parent be given the fact sheet on the EUA and the vaccine. In fact, we at DHEC are meeting tomorrow with our legal team just to talk about how do we want to manage consent for this vaccine for this particular age group. For example, it could be that a parent could sign a consent form in advance, but not necessarily be present during the time that a child received a vaccine, for example, at a school-based event.
Are there any remaining questions for Dr. Kelly? Got time for one more question. There's a quick one. Going once, going twice. Thank you all so much for your time. That does conclude today's briefing. Dr. Traxler and I will join you again on Friday. Please tune in to hear our thematic music this Friday. Thank you all so much.
Thank you, everyone.
Thank you. Thanks so much.